Abdominal Aortic Aneurysm, AAA, is a condition in which the aorta, the largest artery in the body that runs through the abdomen, becomes enlarged and weakened. As the aneurysm grows, it can become more prone to rupture, which can lead to life-threatening bleeding. AAA is often asymptomatic, but some people may experience abdominal or back pain, a pulsating sensation in the abdomen, or other symptoms. Risk factors for AAA include smoking, high blood pressure, atherosclerosis, hardening of the arteries, and a family history of the condition. Men over the age of 65 are also at higher risk. Treatment for AAA depends on the size and location of the aneurysm, as well as the overall health of the patient. Small aneurysms may be monitored with regular imaging tests, while larger aneurysms may require surgery or endovascular repair to prevent rupture. It is important for individuals at risk for AAA to undergo regular screening tests to detect the condition early and prevent complications.